Hi everyone, my name is Dr. Laxmikanth Jella, Neuro and Vascular Intervention Radiologist, Cherian Hospital, Kaliseri. Today we shall discuss about what is the Intervention Radiology department and what are the procedures, how does it differs from all other branches. So usually Intervention Radiology is not a separate branch, it is the branch which closely works with all other branches and it gives its supports to all other branches. In intervention radiology, most of the procedures there is no need of cutting or suturing, or there is no need of any major long hospital stay and all. In all the procedures, most of the procedure we use pinhole surgery, we call it as it will be broadly categorized as non-vascular and vascular. Non-vascular will be like biopsies, like from FNAC for thyroid. Everyone knows that for thyroid with small needle we will do FNACs, that is under ultrasound guidance, so that we will not miss the lesion. We'll go and target exactly the lesion and we'll take the FNAC or any other organs by using different modalities like CT and ultrasound. We go and take the biopsies, and if there is any abnormal fluid collection in the body, we'll go and put a tube with a small hole and we'll try to drain it out. This is called drainage procedures. These all are non-vascular procedures. And when it comes to vascular procedures are broadly classified into neuro interventions and non-neuro interventions. These all the vascular procedures we will do it in cath lab. It's like everyone knows that cardiologist does the heart stenting through hand or leg, and the separate room, that is cath lab, where using the x-ray guidance we treat all the diseases, vascular issues. Like when it comes to neuro interventions, through the small, if there is any brain stroke happens due to blockage of the blood vessel of the brain. Suppose example, for this there is no need to cut or do anything, but we can go through the small needle and catheters from hand or leg into the blocked artery in the brain, and we using the special devices we can remove the clot, so that brain blood flow is restored and function is also restored. The same way, if there is any brain vascular issues like any aneurysm is nothing but we used to call as time bombs of the brain, which slowly brain blood vessel bulges and it will burst. So it after that the bleeding, the patient might have severe headache, and we might lose the patient also. So in this condition, previously neurosurgeon used to cut the skull, go into the brain and do clipping procedure. Currently, using the latest advances and devices, through the small catheters and small, without cutting or suturing, through the hand and leg, using the x-rays in the cath lab, we can go into the brain, that we can treat that balloon like bulge of the vessel so that it doesn't rupture again. So all these procedures there is no need to open or suture. And any vascular, like if there is any severe stenosis or block in the brain blood vessels or any vessel going into the brain, we can go selectively, they go there and we can stent it, so that the flow will be normal flow is restored. That is like in the neuro intervention. When it comes to other interventions like gastro, we can do like gastro interventions. When patient is bleeding inside, we can block selectively by going through the hand or leg vessels. And also like pulmonary interventions, like pulmonary vascular issues, like in TB or any cancer patient, if they are coughing the blood out. So in those diseases we can selectively go and block the blood vessels. And any aorta, that is the major blood vessel of the body, if there is any aneurysm or if there is any narrowing, we can treat all these diseases through just pinhole surgery without any cut or sutures. Because of this intervention radiology procedure, there is the hospital stay for the patient will be very less. And you can discuss regarding the intervention radiology options to your clinician in all the interventional radiology is not a separate branch. We work closely with all the branches.